All right, I'll call to order the West Milton Council Workshop for March 24th, 2026. Can we get a roll call?
Mayor Sodders?
Here.
Mr. Vogel?
Yes, here.
Mr. Todd? Here. Ms. Gregory?
Here.
Mr. Hurst? Ms. Metz?
Here.
Ms. Richardson?
Here.
All right, first we have the CAC Isaiah's Place presentation.
Okay, before we get started with that, I work closely with the Isaiah's Place, and Jennifer has been the key proponent in getting the Isaiah's Place up and running over the last several years. And she's going to give you a little overview here in a few moments, and I'll introduce who she is. But I wanted to bring to attention, if you recall, back at the first council meeting in March, at the stated council meeting, you had a proclamation. I wanted to present that to her tonight in honor of us remembering all the victims and the kids of child abuse during the month of April. So we have a proclamation that we have signed. I'm going to let you take it back to your office, and you can have that sit on your desk each and every day to remind you. And then what's the day again for everybody to wear blue?
April 8th. So
April
Wednesday,
8th.
April 8th. Yes. If you'd like to join us and wear blue wherever you're at and take a picture and share it, that's kind of the national day to remember child abuse.
So this is Jennifer Nisley. She is the Isaiah's, she works for Isaiah's Place. CAC is a part of that. But Jennifer is the director over the Child Advocacy Center, and I'll let her talk about all the things that she does. Thanks.
This is awesome. Thank you guys. That's super cool. I've never had anything like that happen before, so you guys are the first. That's super cool. Like you said, my name's Jen Nisley. I've been here, I think I've tried to come every year since we've been opened. If you weren't here or kind of haven't heard the presentation before, I like to just come every year and share what we've done this past year. You guys contribute to our CAC as well. And so we'd like you to just know where your money's going, know what services we're providing to the children and families, law enforcement, and folks in your agency. So real quick snapshot of what we do. We respond to the child abuse allegations in Miami County. So we coordinate the efforts of law enforcement, CPS, victim witness, our prosecutor's office, and then our mental health and medical providers that respond to those kids. By having them come to our agency, they can be interviewed in a neutral, kid-friendly environment by a trained specialist child forensic interviewer. So we're not having to do those things at like the police department or some of the other places that maybe wouldn't be so kid-friendly. And then we kind of wrap around the family, provide medical services, free mental health services to those kiddos, and really just try to make sure that they can get what they need to start their journey to healing. So we opened a little over 3 years ago. And what I like to do every year is just share with you kind of our numbers so you can see what we've done or kind of what's changed or what the updates are for the past. The next slide after that just has our total kids that we saw last year. So we saw about a 35% increase from 2024 to 2025. This was our total number of children served, and this was all of Miami County. What I tell people, this is not all of the child abuse investigations. We can't handle primarily the sexual abuse, severe physical abuse, any minor victims of human trafficking that are identified in the county, as well as any kids. We kind of have a catch-all called witness to violence. The kid witnesses a homicide, a severe domestic violence, or some kind of crime. That's why I tell people if they've witnessed a crime and somebody needs to talk to them, that's what we do. So that was our total number of children served. And like I said, that was up about 35%. Type of abuse, we continue to see the majority of sexual abuse cases. So you can see the breakdown. Physical abuse, those are typically severe cases that are likely maybe needing medical treatment or going to result in maybe some criminal charges. Neglect is the next category. C-sex, extortion is the next category after that, and other kind of is our category that captures, like I said, some of those witness to violence. We had a rise in those situations this past year as well. This is just the age breakdown. So this percentage has stayed pretty consistent for us. You can see just the percentage of children that we see come through the center. So the majority is that gray, which is our 11 to 17, so our school age kiddos. Jurisdiction, so this gives you the whole breakdown law enforcement wise. So we, any law enforcement agency in Miami County or any child that lives in our county, if one of those is true, they can come through our center. So if the kid lives here, maybe the crime happened in a different community, we could still see that kid, or vice versa. So this just has it broke down a little bit more by the law enforcement jurisdictions. Of particular interest probably to you all is that lighter blue color. That is West Milton. We had 17 kiddos that met our criteria for CAC services last year. I broke it down a little bit more for you too so that you could see. I didn't include this on the PowerPoint, but I just went back to see just out of curiosity. So in 2023, we saw 4 children from West Milton. 2024, we saw 11. And then this past, like I said, 2025, we saw 17, which for you all was a 54% increase. This has a breakdown in cases versus kids. So what I mean by that is we might have one case and there's 5 kids in that one case, or we might have, or flip-flop. So we had a couple situations where the case met the criteria, it was screened in, we didn't end up doing a forensic interview. We had one child who wasn't quite verbal enough to participate. We had one who had been interviewed previously and due to some other concerns made the decision not to re-interview. So that gives the breakdown of cases, and out of those cases, which kids receive forensic interviews. And we broke it down by month for you all. These are just some other things that we provide. So we do try to provide some presentations, training to our community if folks are interested in learning more about child abuse or how they can help prevent or recognize it. We do that. We also do mandated reporter training. So we do some of those for schools or anybody basically who asks, who has staff that works with kids. We can help with that as well. This past year, we finished training all of our law enforcement in Miami County. It took us a little bit to get through everyone. And so in 2025, we finished up with Troy, Piqua, and Tip. West Milton was one of the first departments that we were able to get trained. So props to you guys for jumping on that quickly. Just some other highlights. You can skip to the next slide. We do, since we've opened, we've added 2 additional staff members. We now have a therapist on site who provides free trauma-based therapy to the kiddos that come through the center. So we're able to get those kids seen a lot of times same week without having to be waitlisted, without having to send them out of our county, and without having to bill them. So that's been a huge benefit for the kids and families that we serve. Just talks a little bit about funding for folks that are interested in numbers and all those types of things. Kind of a little fun fact, we continue to serve for much less than the national average. So nationally, other CACs across the country, it costs them about $2,500 to serve a child. Locally, we do that for about $12.95. So we are proud of that. We also, because of our growth, are looking to add some additional staff though as well to try to help with the influx of the need for interviews. These are just some comments. So we survey not only the multidisciplinary team, so that team that we work with that I mentioned at the beginning, but we also provide surveys for families after they come through the center just to get feedback on what we're doing well and what we can maybe improve upon. This might have been your suggestion at our steering committee was to include some of that in these presentations. So these were comments that were pulled directly from the surveys that we give to caregivers afterwards. And the goal is to be a safe, comfortable environment for these families and kids to come to. We want it to feel very different than some other places that we used to talk to kids, and we want them to get what they need and have all those services in one spot. And so those were some of the comments that we received the past year. And I think that's it. So open any questions if anyone has anything that they'd like to ask. Like I said, this is just a kind of yearly, here's what we've done. We appreciate your support. We are really proud of what we've been able to build. Your community and your chief and police department has been instrumental in that as well. Chief Wright's on our steering committee that meets quarterly and kind of helps guide and direct the program. And so we're super happy to be here and thankful for you guys' support. Yeah.
Just one question on the highlights. You have on here that you renewed contracts with 5 school districts.
Yeah.
I didn't see all the school districts in Miami County on that. Is there a reason
Yeah, so
it just take time or?
So we, when in early 2023, Aaron's Law passed, and Aaron's Law required all public schools to provide sexual abuse prevention training for K through 12. We initially purchased a curriculum and did the training to be the facilitators for that, and then offered that free of charge to our school districts because they didn't have anything. At that time, all of them kind of jumped on and were using that program. Now that it's been out for 3 years, the schools come out with some like free online versions, like through Public School Works and other options that they do for some of the other things that they're required to present. And so some of them have decided to use that instead. So that's why there's a difference.
Milton Union was one of the first schools that 3 years ago jumped on, and she actually came here, and I think was one of the first schools that she did.
Yeah, we trained all of the staff. There was a staff training component to that law as well as a kid component, and so we went out and did all of the staff training components for every school district, all the public ones except for Newton. And then we had most of those districts jump on as well to that curriculum.
Okay,
Yeah.
sounds great. Thank you.
Yeah. Anything else?
I do have a question. First of all, thank you for what you do for our children. This just breaks my whole heart. Like, I learned more about the program in a meeting one time, and I had to walk out of the room. My understanding is you guys have a need for foster parents?
Yeah, so so Isaiah's Place started as a foster care program. We are a program under them. So that is kind of their initial bread and butter, if you will. They started as a foster care program. So they license and recruit and train treatment foster homes in like the Miami Valley area. And so they are continuing doing that. This program is under their umbrella, but we function pretty separately in that we've got a separate steering committee, a separate budget. We don't have a revenue source like the foster care side was. So we fundraise and write grants and that kind of stuff, but they are always looking for foster homes for sure.
Can you share if somebody wants to be a foster parent?
Yeah. So our website has, I think there's like a kind of like a quick tab you can go on and click if you're interested for more information. You click that and fill it out, then they have somebody that will contact them. It even has some of the basic requirements on there as well. So you can see background checks, drug screening, they do a safety audit, a home inspection, those types of things, 24 hours of training to get them kind of up and running, and then provide all the support and ongoing training that's needed to keep them licensed. Yep.
Thank you.
Yeah, good question.
Bob Leibarger is the director of Isaiah's Place, and he's been very supportive of the CAC, but he's also a great resource for a lot of things in the community. Bob's just a great guy.
Yeah.
Thank you.
Anything else? Thank you, guys. I appreciate it.
Thank you.
Thank you.
Thank you.
All right, next we have the Ohio Rural Health Hub presentation.
All right, thank you so much for having me, everybody. My name is Brad Trossel. I am the president and CEO of Market First. I work directly with a local organization, business called Buffalo Pacific. Buffalo Pacific has been around for about 10 years now, and they've created some new patented technology around medical and around financial services needs. And so I don't know if the presentation was going to go up.
There we go.
Okay, yeah, perfect. You can go into the next slide if you will. So yeah, again, I'm a networking and consulting firm as far as that goes. We just help kind of connect the dots and help folks like Buffalo Pacific to you find folks like yourself who might be interested in doing something in their communities. You can go into the next one. So Buffalo Pacific is actually located in Troy, Ohio. They have an office in Troy. And as you can see in this building, on the left side is the financial services side. In the middle is the rotunda that actually has a meeting and conference area. And then on the right is the medical facility. That medical facility was actually utilized primarily by Premier Health as well. So they actually have a medical clinic operating in Troy. So if any of you folks want to come and take a look at the technology there, you're more than welcome. One of the things that they really have patented and really specialize in is this 3D telepresence technology. So it's literally like Star Wars type of thing where it's a telepresence, it's 3D technology, so you have an interactive conversation with your physician. Another thing that I've been talking to a lot of municipalities, a lot of villages around the state of Ohio, and a lot of them are also focused on behavioral health and mental health issues in their communities. They see a rise in opioid addictions and different issues. So bringing this technology in to have that 3D interactive kind of interaction and holographic technology can also help with some of these other needs as well. You can go to the next slide. So these Omni Cottage is basically just a small building, nothing very, it's just a cottage kind of building, small medical facility, and I'll show you guys as well the, let's see, show you a little blueprint as well. It's just very simple, as you can see, waiting and reception area. The Omni carriage and percentage is in the exam room, so it looks like a medical facility. One thing that we are going to include is a special entry in the back for ambulances, because we've seen that as being a need for rural health areas. So it's just basically coffee restroom area, reception, waiting room. It's very small, and actually these range in size anywhere from 660 square feet all the way up to 3,000 square feet. So the one in Buffalo Pacific is actually 8,000 square feet, but again, that's a multi-unit type of facility. You can go to the next slide. So again, we talked about this Omni Cottage, what it's going to be: a compact community-based clinic. It expands access and essential medical and behavioral health care to remote areas. That's really what we're focused on. I've been talking to a lot of communities. There's a huge amount of interest. In fact, there's several funding options available, because I know that's going to be one of the questions that we talk about. The Trump administration has, in the Big Beautiful Bill, released $50 billion over the next 5 years for all 50 states that's available for rural health initiatives. That money has been passed down to the states. Ohio has received, as of January 1st, $206 million. They have their first round of funding available that was actually due in March, and their second round of funding available is coming up in April. So some of those initiatives for Ohio specifically, it's called the Ohio, I think, Rural Transformation Program, if you want to look it up. But it's basically, it's broken down into different parts. Behavioral health is a part of that. Pharmaceuticals are a part of that. But also a facility building and maintenance is a part of that, and of course new technologies to bring more advanced technologies into rural health. So we fit all of those needs, not all of them. We could do a pharmacy as well, but that's not really what we're talking about today. But you can go to the next slide if you'd like. So we're also working with some additional folks named VitalLink, and they provide additional technology, and they also provide some agreements. For example, they have an agreement with New Health in California, and New Health has the ability to provide that 24/7 remote physician network if that's needed for your community. So they'll charge a percentage, obviously, to the insurance, and then we can also make it so there's some sort of a kickback to the municipality. But they also have created several patented technologies. Buffalo Pacific has 15, I believe, patents, and VitalLink has several as well. But the 3D holographic communication technology is Buffalo Pacific's, but now with VitalLink, we also have AI-powered diagnostics, which basically, when you come into a scanning room, it's an AI-powered scan that can tell you basically what's wrong with you in a lot of different ways. It can tell you serious issues that you have. It can tell you your weight. It can tell you your blood pressure. It can tell you your height, everything. And this is all from a digital scan. Optical vital scannings, brand new preventative scannings, especially for breast cancer awareness and some of those types of things. There's quite a few preventative scannings that I think will be necessary for rural health folks to be able to get these screenings, and then if they do find something, then they can go into a larger facility and be treated. Multilingual telehealth, I believe we have 267 languages available. I know that's not going to be an issue here as much, but we do have other languages available if there are folks from other countries who actually, in other languages who utilize the services. And mental health support as well. We also have a patent that we're developing on mental health support and multi-module specialty integration. So the mental health part is really something that's key to my heart, and the president and CEO, David Allen, I know it's key to his heart as well as these facilities. I remember he telling me that David telling me that when he was a boy, the doctor used to come to their house, and they had 7 brothers and sisters, and he loved that. He loved having a doctor close and where they were in proximity. And then he came about 10 or 12, and then he had to go a half hour, 45 minutes in to see his doctor in the town. And so he was like, I'm going to solve that one of these days. And this is kind of one of the things that he's trying to do is bring rural health into more of the forefront of where we're at. So you can go on to the next one. So this is on the financial services side of Buffalo Pacific, but this is kind of just a portrait, a picture to give you an idea of what the 3D holographic imaging technology looks like. It's actually, it'll be like a person that's sitting there talking to you and not just like a screen. So it's pretty cool technology. The doctor also, the physician will also have a small device in their physical location that will be able to connect and have that 3D experience. So pretty neat stuff. As we can see, there's a huge need in the state of Ohio for rural health clinics, for FQHCs, which are federally qualified healthcare centers, and there's just not enough, right? I mean, we just need more access to healthcare within the state of Ohio. So that is really what we're trying to accomplish here. You can go to the next one. And of course, around the country as well. We're hoping this will be a nationwide thing. We want this to be the Dollar General of rural health, if you will. You can go on to the next one. And again, so what we would like to do as far as next steps, obviously you're in the driver's seat. It's your community. You know what's best for you. You know the contracts you have. Like I said, you've worked with Premier Health, we know, but you may not want to work with Premier Health as much. I don't know what you're looking at or how you want to pursue that. But there are funding options available. Like I said, there's the grant money available. There's also funding available for some of these health networks who will come in, providers who will, there's all kinds of them popping up all over these areas that I talked to. Mary Rutan, for example, in Bellefontaine area, and Mercy, there in St. Paris, and there's all these different organizations who are coming in and trying to get into these rural communities, and I think it's fantastic, and we are able to work with them as well. So if they want to utilize our technology, that's fine. We can work with them and provide the absolute best care for you folks. If any of you would like to come into Buffalo Pacific and Troy and see the technology in action, you're certainly welcome. We've already done that for a couple of communities and we'll continue to. After that, there will be just a memorandum of understanding, just to understand exactly what we're looking at as far as where the location will be for the specific Omni portal or the cottage, and what the funding will be coming from, and then what the steps and planning procedures will be as far as the actual rollout to ribbon cutting ceremony. So with that, I also provided you with Q&As document, so you can look that over, or feel free to ask me any questions that you might have.
I did not look this over yet. Maybe I should have done that first, but I do have one question.
Yes.
So I understand that you represent Buffalo Pacific, and they're on the technological side. So am I to understand there is not a set healthcare provider already in place, that you would be selling the facility and the technology to us as an asset to then find a healthcare provider to utilize it?
Well, I'm saying that we do have New Health available. We do have a contract through VitalLink with New Health, and that's an organization in California who can provide 24/7 care. But no, you are not locked into that. We can work with really any healthcare provider that you choose. So if you have a specific healthcare provider that you choose and you'd like to work with, we can certainly utilize them, their technology, and we can work together.
Okay. And then, so billing-wise, New Health out of California that may or may not be within or outside of the insurance, sphere for anybody in here.
Sure.
Like, it all gets billed through them, right? Anyone that would go and utilize this. So that kind of might be out of the wheelhouse for.
Well, and that's why, and I've worked with a lot of different villages, and every village has their pick and choose of local and regional. Most of them are choosing to go more toward regional providers, and for that reason, because they know the local insurance plans and they have already those contracts in place with those insurance plans. No, the New Health is just one option, and they do. I don't know off the top of my head, but I know they do have a huge list of insurance providers that they work with.
Okay.
Of insurance agencies they work with, and I can get that list for you as well if that's something that you would need. But the point is that I don't think that's going to be a game stopper as far as who we work with. I think what we need to establish is this something that the community needs, and what are the proper steps in getting there, right? And those would be one of the steps that we'll have to tackle along the way.
So, I'm gonna have a lot of questions. So you guys would come in and like build this building, the cottage
Correct.
building,
Yes, ma'am.
and then run a medical facility, but you could partner potentially with like Premier Health
Correct.
to have like a mini doctor's facility.
That's correct.
And it's mostly telehealth.
Yes, ma'am. Yes, you'll
Okay.
have a nurse practitioner, normally 1 to 2 nurse practitioners within the actual cottage. And then from there, it would be primarily telehealth. What we would like to do, and what we've been talking about with some other villages, is they'd like to tie it in with their fire station as well. So like I said, we have an ambulance access to that, and maybe some additional support or, emergency type services where they can utilize the clinic for emergency services as well.
Okay, and then what would be our role?
Mm-hmm.
Would it cost the village money?
Well, that's going to depend on which direction you take as far as financing. If you decide to go the federal grant or the state grant route, then no, that's going to be grant money that's going to be provided from the state of Ohio. If you do apply for that grant and are awarded that grant, then you can utilize that money for the construction and maintenance of the property and the project, as well as the technology therein.
Okay, and that state grant money came from the federal grant money from the Big Beautiful Bill?
That's correct.
That
Yes, ma'am.
$206 million.
That's correct. So
Okay, so
the
it's
way
not even state money. I mean, it's trickle down. kind
That's
of.
right. So the state money is being released, the federal money is being released to all 50 states, from what I understand. And not every state, I don't know if every state has applied for it. They had to apply before the end of last year. I know that Ohio did apply, and Ohio was granted $206 million. Okay? They've only released maybe 10 million of that right now for this year. However, they're going to have another $200 million next year. So there's $200 million available for every year for the next 5 years until 2030.
That's
So
fantastic.
we're in a really good window right now as far as that's concerned. The other thing would be if a Premier Health or some other network wanted to come in and partner with the village, with ourselves, et cetera, and we could, they could fund most of that, or, as well. Or the third option would, of course, be, and I have that in my Q&A, the third option would be some sort of a funding effort from the community, right? Where they want this to be a community-owned portal and, like you're saying, very low rate, cheaper, I won't say cheaper, just less expensive type of model that will be a community-run, facility. So it really in your hands. This is what I also say to villages. Typically, when the municipality or the village provides the land, then obviously the village or municipality is going to be in charge of running the facility, maintaining the facility, and will receive the funds from the facility, right? And we believe that there will be extra funds. I mean, if you were able to work, for example, with a provider, let's just say, it probably won't be this much, but let's say you have 20 people per day that come through 6 days a week, and it's $50 a person that you get as the municipality, okay, as the village. That's $316,000 a year. So that can more than fund the nurse practitioners. It can provide all the maintenance, anything additional that you'll need, and probably put some money back into, the village's hands. So I know we're not doing this to make money. That's not the purpose of this. The purpose of this is certainly to help people. But then, for example, you might be able to take that money and put it into behavioral health, where we have an additional portion of the building on the back, a specific place that has another Omni Cottage or whatever. Another Omni Portal in the back for specifically behavioral health, and it can be kind of multifunctional, or even banking solutions or things like that. So there's a lot of different directions we can go, and quite frankly, villages are taking all different directions. It's kind of like the Wild West, and I'm having fun with it. I'm trying to lasso it all together and keep it all together, but yes, thank you for your questions. Any more?
Yeah, how many communities have you put these in so far?
Yeah, that's a great question. We're just getting started. The grant money just got released. So I'll tell you, I have to be careful because I'm under NDA not to get too deep in the woods, but we have nationwide interest. From the sounds of it, there could potentially be one of these in every single county in Minnesota in the next couple of years. We're hoping that they'll be in every, all over the place in Ohio as well and other states. We also have been working with several universities who would like these medical facilities. We're working with, tribal nations. We're working out in New Mexico. We're working in DC. We're working in Louisiana and several other places. So to be honest with you, we're just getting started, but there's a huge amount of interest.
Perfect, thank you.
But we do have a facility that was operational in Troy that you can come and see.
Perfect.
Yeah.
So did you work with the city of Troy on that one?
That was privately funded by Buffalo Pacific and Premier
Okay.
Health. Yeah,
And Premier Health was involved with that?
that's correct.
Okay, so because we do have that relationship with Premier Health, so there would be a possibility, and I'm just speaking for me, I don't know, and I'm just learning about this right now. Because I don't know that the city necessarily wants to be in the medical field. If we want to own, have that additional responsibility, and I don't know, that's just kind of the question that comes up in my mind is, I don't know that we want the responsibility of running a medical facility, but if you partnered with Premier Health and we got grant funding to pay for this building.
That's right.
Okay.
And then Premier Health can run the day-to-day operations.
Do you know if the one in Troy is Premier Health providers?
Again, I'm under contractual. I don't know all the details of what that contract was between Buffalo Pacific and Premier Health, but I know that when it was operational, yes, it was absolutely through Premier Health. I'm not exactly sure who or what the agreement was.
Yeah, just thinking if they're already doing it there, it'd be easy enough to.
And yeah, they've already worked with us in the past, and they know our technology, and we've actually increased the technology stack since then. So I don't think they'd have any issue with that as well.
I have one more question.
Yes, sir.
And not to play devil's advocate because he doesn't need one, but in this funding we're talking about from the Big Beautiful Bill that was released to the state level, this is not exclusive to Buffalo Pacific or what they're doing, correct?
No, sir.
That can be accessed. So, again, what is stopping a healthcare provider from moving into an area and opening their clinic and partnering with the community? Because obviously this is all very neat, and the hologram part, I get that is patented, but telehealth is not exclusive to what Buffalo Pacific is doing. That's
Right.
everywhere. I go to my doctor now, and I don't even want to, and I have to talk to somebody on the camera. So I guess, where's the value added other than Buffalo Pacific getting their slice from not going directly with a healthcare provider and opening a rural clinic, of some sort?
Yeah, that's an excellent question, and the answer is that you absolutely can use that grant money to work with a local provider, absolutely. And what makes the difference between Buffalo Pacific, I would say, is certainly the number one thing is our advanced technology. Not only the 3D holographic technology, but again, the vital scanning technology and all the technology that we've built into this platform to make sure that your clients and the folks here will have the absolute best care, unmatched, literally. So that's one. The second one, I think, is just the fact that we are, I think, a provider would maybe have more of a difficulty working with the community where it's community-owned land, whereas Buffalo Pacific would have less of an issue with that, right? I think we would be more willing to work with you, I would think, and give you more of the reins, if you will, and more of the leadership and more of the control than maybe some of these other institutions may.
Does it have to be on community-owned land?
It does not. Nope. We have folks who actually, one community is looking at turning a Rite Aid into an Omni Cottages. So that's one of the options. There's certainly different ways and procedures. And there's another community that we're working with who wants to do actually a community center. And they want to have medical included in that community center. They want to have behavioral health included in that community center. They may even put some financial services in that, but they're going to have other things as well, pickleball and different things within this community center. So it's going to be included within their vision.
Okay, one last follow-up question, just because I'm familiar with the location in Troy, because I go to Marion's Pizza a lot. It never seems very busy.
Yeah.
Is that operational still? What's
At this point, no. And the reason that it's not is because of two things. One, I think that was the COVID-19 thing. That was a very difficult challenge for Premier and for this situation. And the second one was they decided to transform their business model from being a day-to-day facility to being, they want to take this nationwide, worldwide. So it's more of a storefront, if you will. It's more of a, yeah, it's more of a showcase.
Okay.
Like a model home.
It's a model. Yep.
Is there an operational one within? I know you said you're just getting these kind of this specific.
Yeah, I mean, the
Image off the
grant
ground.
just got released in the end of December, and we just started. I mean, we have the technology built. That's what we did the whole last year because we were already going in this direction anyway. But we did not pursue. We were pursuing universities and other avenues, but we're only pursuing rural health now. That's really where it's
Okay.
at.
But as of this moment, we don't really have like a proven model out there.
At this moment, no.
Okay. Just one. Okay.
Yep. Great questions.
Thank you.
And you guys would fill out the grants and stuff?
Well, that would depend. VitalLink does have grant writers available, but that's something that would have to be contracted, between the community and VitalLink.
That's helpful,
Yeah, sure.
because they're big grants.
Yeah, sure. All right. Are there any other questions? All right. Thank you, folks. Have a fantastic day.
Thank you.
Thank you.
All right. Next, we have the RFQ for wastewater treatment plant update. I guess that's probably Ben.
Thank you.
That'd be you, sorry.
So, okay, so Jeff Sheridan sent these out. He picked, they picked 3 engineering firms, and then they advertised also for the RFQs for the wastewater treatment plant. So he sent them out to LJB, Wessler, and DLZ. We didn't get any other inquiries back. So Ben asked me to, get a committee together, get these, going through so we keep on the timeline. So we formed a committee. It was myself, Corey McCarroll, Ken Armstrong from the wastewater treatment plant, Jimmy Gardner, and Megan Shaw from the front office. So we had like an introduction meeting. We talked about, what our responsibilities were going to be, and we had 2 weeks. We were going to, dive into these RFQs, look at their qualifications, look at their, we asked them, the scope of the work because it's provided in the packet we sent to them. Their, qualifications, and their, if they have enough time to do that project as a firm, if they're not too busy. So we went through all that, and then each committee member is given 3 grade sheets, 1 for each firm, and they're graded on the experience, the project manager and the personnel, the technical approach, and understanding of the whole project itself that's laid out in the packet. Their location, their experience with funding, and their workload and availability. So all 5 committee members picked Wessler because their understanding of the project, their personnel, their experience, and their funding. They get so much more grant money and more zero interest loans and principal forgiveness loans. So, we looked at every aspect. Like I said, Wessler, everybody picked Wessler as their the best firm. So the totals, so out of 500 possible points, adding all 5 committee members together, Wessler had 461, LJB had 417, and DLZ had 404. their references. I put together 5 questions and called some of the references. DLZ, well, Wessler and LJB gave their references, contacts, and phone numbers. DLZ just put the jobs they did with no references or contacts or phone numbers. So I did call them. We put together 5 questions. So they all, were pretty happy with each firm. So that didn't really weigh into the decision. But other than that, if you guys have any questions.
I mean, sounds like you guys looked through it and the grant opportunities or the no interest loans. I mean, that seems
Yeah.
huge also.
Yeah,
That
so there's a lot of money out there yet, so hopefully we can get this all going, because it's a time thing now with the wastewater plant.
ticking time bomb.
So, so we'll get it going, and so hopefully we get some good money and get it built. And,
Yeah.
so.
Yeah, and then once Wessler's notified, then we'll work with them to put together like the proposal with the construction plans, designs, the bidding, and funding, securing funding. Then we would bring that back to council for council to review, and then answer any questions, make any potential changes, then council would vote. And in the meantime, we'd be working on like a 0% loan, which would pay for like upfront engineering costs that would then be rolled into the construction loan once that's secured.
Thank you for doing all of this hard work.
Sounds like the committee was pretty busy.
Yeah.
Sounds like a lot.
Yeah.
Yeah. Tim's an asset.
Agreed.
Actually, Corey and Ken had a lot of good input, because they talked to a lot of, people in the business, and they get a lot of feedback from from the PLCs they use to run the plants to, like some engineer firms, they hire co-firms, which if there's a plan change, that's an additional $20,000. Or if it's, if you want to call them for something, it's $2,000 an hour, 2-hour minimum. It's just, so they really looked into the whole story of the funds.
Sounds good.
Excellent, thanks.
Yep.
All right. Next, we have a retail strategies update, I guess.
You're looking at me.
You're in charge.
I'm not in charge. I don't want to be. So, retail strategies, we have a contract. We have 2 contracts. We have the commercial attraction side, which is working with, the Stillwater development, the large national commercial chains. And we can do an update with them, like virtually. They can send us information, whatever, like kind of questions, if you have questions. They just kind of chug along their own pace. They will be going to the ICSC in Las Vegas, and thankfully I don't have to go again this year, because they are going to represent us and schedule meetings, and they will give us a full book of everybody they met with, what happened, what the conversations were about. So they're still chugging along. I know they've been to several different conferences representing us. So the other side of the contract, the other contract that we have, is for the downtown. And we have a strategic plan. They drafted it, we reviewed it, and we have a meeting on April 7th. That's going to be a virtual meeting for just the team to kind of go over everything. So the plan, it came together really well, and I'm really excited to see some of the ideas they had. We're going to have a lot of committees. We need a lot of volunteers. If you are watching this, I need you to volunteer, because we need a lot of volunteers.
Can I say one small thing? And for volunteers, it's not like a forever volunteer. It's to see a project through that maybe is like a 9 to 12 month thing and move on. So it's not a lifetime volunteer opportunity,
Yes,
unless you want it to be.
Which is great, because sometimes, sometimes you get burnt out when you volunteer for a really long time on something. One of the action plans they had is, so one of the big things that affects council is there's some pieces of legislation, the vacant building registration. I think we're pretty close to getting that through. That's a big one, and there's a couple different items that they talked about as legislation that we can work on. And then, let's see. I have notes, so I apologize. So one area that we're missing now, because Mr. Sheridan was part of that downtown committee, is we don't have anybody at this point from West Milton Village staff representing the village of West Milton on this team. So one of the ideas I had, and we can talk about this as council, because I know Ben is probably way up past here, but if we had a member of staff, if that is okay with council, and Ben had a member of staff who wanted to be a part of this team. It's not I mean, it's a big commitment, but it's not this massive full-time job commitment. It would give somebody an opportunity to grow, to learn, to be a part of our downtown revitalization. If council has thoughts on that, like having a staff member, whoever that may be, I don't have anybody in mind. I kind of touched base with Ben a little bit about it, to fill that need, and we're going to need that on the commercial side as well, like a liaison for retail strategies. And it could be 2 separate staff members, it could be Ben, it could be whoever, but just kind of an idea to throw out there to give somebody an opportunity to develop themselves and their skill set. I'm reading my notes.
Can I ask a quick question, or should I wait?
Of course, go ahead.
Okay. On this, you're talking about the commitment for one of our staff members on this downtown revitalization team. What kind of time commitment is that more specifically? How often does that team meet?
Once every couple of months.
Once every couple months. And that's to kind of do what? Review the suggestions from retail strategies?
Yeah, so far we have worked on the strategic plan. And then it would be the implementation. And it would probably be more of a time commitment once we have that strategic plan and we're actually implementing it.
Okay.
But then that way somebody in staff knows what we're doing.
And I'm sorry, the strategic plan is they're provided, or you guys are working on that with them to create it?
They've created it.
They've created a strategic plan?
Yes.
Okay.
And then we went through, asked questions, and they're finalizing it, and we'll have it mid-April.
Cool.
So with that strategic plan, what all is included in that for the residential portion or downtown? Is this something that comes to council that we have to review and approve? How is things structured with the charter with retail strategies with that? I'm just trying to find out how that all
That's a good
that all
question.
works.
I mean, we could approve it if you wanted to. So there's four key areas. Policy administration, which is council and legislation. Design, tourism and promotion, and then economic vitality. So there's going to be different teams that will do, like one of the things they mentioned was we've got a couple alleyways in between buildings, that there's not a road there. I'm thinking like between Sugarland Social and 28 Marketplace, there's that like grassy area. So there will be a team who can work together to design something and implement that, whether it's like seating or benches or murals, because we love murals. So there would be a team like to implement that.
Or I was thinking their suggestion, a team to get downtown merchants all together. And so hosting like First Fridays where all stores stay open, past 4 p.m. Once a month. So there needs to be some sort of team and a lead on that team who contacts every store owner and sets up some group email or group Facebook or text chain, gets them all on board, and works with some sort of marketing design. And that was one of the things too, that we keep all the design cohesive. And so it's not my design of like geometric and yours of 90s jazz, you know, whatever. But we have this cohesive theme to what we're trying to push through the town. The signage, making even it like a walking trail, signage for parking, signage for like a mile loop or something that you kind of take the shopping trail, signage for a Dora if that was going to be part of it, or Dora is its own thing. So there's really like I think building owners, store owners getting together and how can we promote our business. Marketing and murals and paintings, and how do you just make things look a little more cutesy, or get people here, festoon lighting, some benches, like some potted plants. Like it's not like millions of dollars, but it's just having the plywood taken off a storefront window and having some lights on at night to make it not look vacant. So some small things, but it takes committees to make those things happen and get everyone on board and have those conversations.
So for those 4 key areas within the strategic plan, once that gets adopted or approved, then you're looking for committees to work in those 4 specific areas within the strategic plan. So we need to ultimately reach out to community members to see, you know, who we can get that would be involved in that type of thing. Within that strategic plan, I'm assuming that they're also looking at the current buildings, facilities downtown that are vacant and they're maybe up for rent or lease. I think the old West Milton Inn is back up on the market for rent or lease. So I had heard that. We got a couple of other places downtown. So this is all intertwined, just all wrapped up into that strategic plan of what they're looking at.
Mm-hmm.
Okay.
Yeah, so the comprehensive land use plan, for an example, is like the whole town, and this is the downtown.
Okay.
So this is one section of the whole town. But then they also had ideas for the other, like the Brewballs building where the Olives, that's what the doggy spa is.
Yeah.
Like they'll give us ideas of things that we could do to freshen up that building. I mean, it looks great. And I'm so happy that there are tenants in there. But so they'll give us ideas for those also, and then the committees will help implement that. You know, like the flowers we have flower pots downtown, but those flowers don't miraculously show up. They
Gotcha.
get Casey and Sarah Kopp go out and they plant flowers and they pick out the flowers and, you know, they do those things. So it's finding those committees to do those types of things.
Got it. Okay. Thank you.
And then we will present, like, once it's done, it will be presented to council and community. So then I want to tie something into this while we're here. One of the key factors in the presentation was a lot of project revival. And the girl that does the like Facebook stuff, she's not an expert at Facebook, although she pretends to be. It's me. And I'm allowed to insult myself. So they talked about like project revival. And the thing with project revival is it's all volunteers. And they also mentioned the name, you know, you're not going to be visiting your family and look up Project Revival if you're from out of town. So one of the things that I've talked about is creating a Main Street program. And Heritage Ohio, who is like the umbrella for the Main Street programs, works very closely with Retail Strategies. I actually went to the Heritage Ohio State Conference last year with Retail Strategies, and we did a presentation together to Heritage Ohio. So we're creating that. We're doing what's called a DART assessment. It's the Downtown Assessment Resource Team, and that visit is on June 2nd and 3rd. and Mr. Todd and myself are going to participate. And I made a Facebook post because I don't know how to do Facebook, but I did make a post, and I've got at least 20 people who have reached out and asked to volunteer and want to be involved. And let me tell you, like, I give the credit for that to God. So I've got a lot of really good people that want to get involved and want to volunteer. There's a couple that actually have shops at 28 Marketplace, which is absolutely incredible. So that they will take what Retail Strategies has done with that, and also I kind of foresee the Main Street West Milton program and Retail Strategies working hand in hand. It's kind of like, in my mind, Retail Strategies, the downtown side, is like the tourniquet to stop the bleeding, and the Main Street program is the healthcare plan for the rest of our life, because that can operate in perpetuity. We can get somebody who is a paid staff member, who is the executive director, that manages that program, that works with the volunteers, that secures funding, that promotes events, that gets donations, writes grants, and that's their actual paid job. So that, I'm really grateful that I had so much good response, and we're still looking for more volunteers. June 2nd and 3rd, we're gonna have a really good couple days with Heritage Ohio being here. They are incredible people, and they also work with downtown and historic revitalization. So our vacant buildings, they can help. That executive director will work to find businesses to come into those buildings, and they will work with getting those buildings occupied. And if you're familiar, Tip City has the Tip City Downtown Partnership. Piqua has Main Street Piqua, Main Street Troy, and I'm working with all their executive directors. This was all their idea, but they are amazing, and they do amazing things. And all those events that they do in Tip City and in Troy, the concerts on Fridays in the summer, the big concert on June 6th, they do those events, but they also keep the pulse of the downtown going. And so that's kind of, we're working on all those together. In my head, it makes sense how they're separate, but it's hard to explain it how it's separate, because it really does all work together. I think the key thing that we need really is just someone from staff. And I think that's all I've got. Does anybody have more questions? I have answers.
Just one.
Oh, sorry.
Go ahead.
No, I was going to just provide more information.
I'm just curious, how often does Retail Strategies meet with Ron and Jason with development details and discussion up on the hill with Stillwater Crossings?
I will find that answer, but I know they have been in communication.
Okay, very good. Thank you.
So one of the things I think was the Downtown Beautification Awards that you sent out the email. That's a strategy through them. They have other strategies that was to provide kind of matching little grants for downtown businesses, like if you want to paint or put new windows or something, if you put in 1,000, we'd put in 1,000 kind of thing. It just gives us more ideas of how to work with the downtown business owners or building owners, and things that have worked in other communities that are similar size to us. So I think with them, they do have background to show us, like, hey, this worked in a community of 7,500 people, and pictures and how that worked and how long it took. The other thing with Project Revival, they put a lot of emphasis on what Project Revival has done, but they said when people come to your town, they don't search Project Revival, so they don't know there's Third Thursday or Rock the Hill. So that's where the Main Street and having it, with West Milton as one, those events will be West Milton events, not Project Revival.
Mm-hmm. So just to be clear, Project Revival will kind of just fade off and not exist anymore, which is okay. This isn't, they all know this, right? Because it is a lot of volunteer effort, and having a structured organization where we're just kind of guessing as we go along. But with Main Street, we have the support of the other Main Streets. We will have the support of an executive director where this is their professional job. And we have the support of all the Main Streets. And Covington's also working on a Main Street, I believe. I'm not speaking for Covington, but there's the conversation. And we would be the first county in Ohio, I believe, to have every like city have a Main Street program, which is just a cool thing to do for Miami County.
Well, thank you for the update. Thank you for what you and Casey and Jennifer, I think you're all three involved in retail strategies. So thanks for all the work with that. Thanks for the update. If we could just get these periodically, that's great information. I think it's great for the public. It's great for us. So thanks for all you're doing. Appreciate it.
I think for sure the next round is going to be big updates when these committees are forming and putting things into action.
Sounds good.
Yeah.
Thanks.
Thank you.
All right.
Well, Megan and Megan, both Megan.
All right. Next, we have 2026 paving program and private parking lot.
Yes, so I'll start with the paving program first. So this year, if you break down West Milton, which is a long community, we really have three what we consider arterial streets that run north-south, and that would be Miami Street, of course, Main Street, and then J Street. J Street gets, so we rate our streets, and J Street's been going down our passenger ratings for years now, but we were waiting on the Bear Steel gas line project to get completed because it just made sense. So it's been a long time coming really for J Street. I think the pavement is around 20 years old, but if you consider the amount of traffic it takes versus some other streets in town, that's a pretty good lifespan. So we're looking at J Street from Edgar Avenue to south to Wright Road. The reason we would stop at Wright Road is because from Wright to Market, we've got some water main through there that we've had 5 breaks on, probably. 5 breaks? Yeah. So we've got some old 10-inch cast in there that we would want to replace prior to paving that last section. And the last section, it's a little bit wider, so the travel lanes are a lot wider, so it doesn't get, it has some construction cuts, but it's not as rough as the rest of J Street. So we went out for bid on that. If you factor in on the bid sheet what we had on budget and what I estimated just for the paving and not including if we would need any risers for the manholes. I didn't include the ADA ramps. We would be at around about 169,000. We sealed bid this. We had 2 sealed bids. The lowest sealed bid was from Fillmore Construction that did the work last year, that did a really good job for us. They came in at $153,457. So we're underneath what I estimated by 32,000 on that. The only other things that factor into that are the ADA ramps. And so going back to waiting on the bare steel to be replaced, Tim can attest because he was out there through almost all of it. We had so much curb replaced and so much sidewalk replaced and ADA ramps in that whole section. We only have 4 ramps, 4 ADA ramps to redo, which is incredible because if you count the intersections, that's a lot of ADA ramps. And then secondly, a program we started about 5 to 8 years ago was wherever we're paving, we go in and we got to get those people to replace their curbs. Because if they don't, Hamilton Street was a great example. It's hard on the street when the curb's breaking down, and aesthetically, it's not very pleasing. The good news on that is after the bare steel replacement, we only have 2 locations for curb, and then I found 1 sump pump. The sump pump's already going to be taken care of, getting out of the street, so that's not a problem. So I've asked Tim to help me work with one particular location that has a lot of curb, approach curb, a business close to Hayes Street. So we've got additional estimates, and we were just going to meet with them because of the price that we're talking about. and kind of asking them to maybe do the curb and the approach at the same time. So Tim and I thought it was best if we just met with those people on site and threw out some ideas to try to get this done as cheap as possible. I did bid all of the work for the curb, and Co-Construction came in cheapest on that. I anticipate 2 assessments. One would be on North J. It's a renter, and the owner is not local. I've sent the second letter out per our ordinance, and I haven't got a reply back from them yet. So my next step is to, after Tim and I meet with Rudy's, then I'll bring back to council. I'll have to send them the letter we discussed, and then all of that for the assessment. So I will get that to you guys early. That way, we'd be planning on paving in August, just like last year. The other part to that is we are currently going through the unidentified water line program with OEPA, which is it's mammoth. We got the grant where we keep track of all this in-house now, which is great, but we have to identify every material line on J Street. J Street's an old street, so you can imagine that a lot of that's going to be needing replaced. So I believe once the crews, and we did get that vac truck, or vac trailer, thanks to council for getting us that used vac trailer, which takes a lot of time away from it. So I believe Tim's going to be out ahead marking those, and then the crews are just going to be excavate them in the street. That way we're not tearing up grass and stuff. So we will get those identified, and if it's not copper, then it's going to have to be replaced out of the right of way, so we don't have to dig on that street. We will get the one water main break, because we always get water main break after we pave the street. It's so aggravating. But anyway, so that is all handled, and I will get that to council by way of award for the low bidder and also the assessments. Any questions on that? Okay. So secondly, I know Councilmember Fogel and myself met with some people last year. Yeah, last spring maybe. And we talked about paving the parking lot. And I don't think I have to tell you guys where the parking lot's at. I think you right now. So we believe that they were going to be open to the idea. And it also turned out that one of the owners, their son, actually does asphalt work. And I got with Manager Sheridan when he was here, and I actually added an addendum to the bid that would have allowed this company to actually bid the paving program. The only area they were shy, they're not ODOT certified, and I always expect ODOT certified because then we make sure that we get people that use ODOT certified asphalt, the proper crews. However, after kind of having a conversation with this gentleman, they would have qualified. Unfortunately, they didn't bid paving. I wish they would have, but they didn't. So we're going back at that to see what we can do with that. If council wishes that we still look at that.
Yes.
Okay.
Yes, please.
So the only other thing I had on that was when I was going through some files, I've just been kind of dragging some files over as I find them. The biggest question that we were getting is, and I can bring it up on the GIS on the TV if you guys want me to, but you've got the parking lot that I showed you guys exactly how much and all that, but then we have the parking lot to the north that belongs to the business and the apartment, or that multifamily, and then we have the post office parking lot. Well, if you remember, I was kind of like the boots on the ground on this project the last time around, so but I did find that there were people saying, well, okay, we would be willing to do this, but why doesn't that parking lot over there have to do it? And then why doesn't the post office have to do it? Because it's as bad as this, And I think they talked to us a little bit about that at our meeting too. But I guess there were more inquiries to that I knew. So that's what I'm bringing to council tonight is I obviously don't want to answer that for council, nor would I ever, but I don't really have an answer for them. I just want to know what council would like to do with that.
I kind of always thought of it as one big parking lot, and then when we started talking about it, it kind of ended at that post office Lavender Alley, whatever, and went toward Hamilton. So in my mind, I envisioned it going further, that multi-unit, the old gleaning place,
Yeah.
post office. In my thoughts, it's kind of one continuous thing. I would like to see it all, but like, it's taken how many years? I've heard, oh, this manager talked about it, and this council talked about it. And
Right.
these business owners are like, we talked about it 25 years ago, no one could ever come to an agreement. So I feel like we're finally the closest we've ever been, so because of you guys and the conversations and the letters, so losing the momentum now, I feel, I don't know, maybe make one swoop and in 25 years they can talk about it again. But if we could get it all knocked out.
I agree. I was going to ask, is it worth barking up the tree? But I mean, I feel the same way. I think it's all one section. Obviously, I understand ownership's broken up. Do you know how that would work procedurally, like with the post office and everything? Because they'd have to get their own.
How they would do it?
Well, I mean, they'd have to get their own approval to pay for that, right? Just the same way.
Yeah, I mean, they would be the same way. It would be, you know, we're doing, you know, these people all decide to do this. You'd be best to hop in on that. However, you can certainly have it done by your own contractor. USPS might have a contractor that specifically
That's the only
pays.
reason I didn't know if they
Maybe,
seemed
so,
to-
yeah. So I guess for the parking lot, it's not separate on paper, but separately owned by USPS. They may say, yeah, we'll do it, but we're gonna bring in our own paper. So these are all things we just need to work out with them, but we can certainly have those conversations.
So how many more business owners? Post office, the multi-unit house, the old gleaning
Yeah,
place building?
that would be it.
Just those three?
Yeah, because I think we had an agreement from all of the property owners for the other parking lot but one that we talked to. So
Yeah.
I guess in the grand scheme of things, we would have to find out exactly what the full cost is going to be to do the whole entire parking lot and do the same thing that we did with those other business owners, find out what their portion would be and have that conversation with them, and hopefully we could all come to an agreement. And if you would want someone from council to accompany you, I would definitely do that again if everybody is
Scott,
fine
Ben,
with that.
Bad Boys right again.
that.
Yeah.
Yeah, and I'm still looking for, I want to find the actual signed agreement. I have not yet, but I know they've got to be here somewhere. And then I guess the final part to that is like last year when Steve Stoss and I went in just to kind of give it a quick look over, there's a lot of work that would need to be done prior to paving.
Right.
There's just stuff on the pavement that's sitting, and there's some overgrowth. And then that one spot would need dug out right off of Hamilton and Base prior to asphalting, because I think the way that we talk, I don't think they want that there anymore.
No,
So-
I don't think so either.
So that would be all of that.
Isn't there a bunch of big rocks or something?
Yeah,
Isn't
there's
there
two
like a-
rocks there
Yeah.
because of,
We'd haul them off.
yeah. Yeah.
Okay.
Okay, sounds
I will
good.
I'm gonna keep looking for those, and then we'll get on that. Any other questions about the curb or paving?
Just one question at the corner of Market and Jay. I saw the mirrors down again.
Yeah.
Broke.
Oh, okay.
Yeah, the wind took it out. Now, I will say that with that fence down, I don't know if anybody looks at the mirror anymore, to be honest with you. I think
Yeah.
because the mirror was there because you couldn't see because
Couldn't
of the
see.
fence.
Yeah, now it's a
And-
lot easier to see
I
around
forgot
there.
it was even down until you brought it up, because I go through there a few times a day and I don't even look at the mirror.
Yeah, I don't either. Yeah. Thanks.
All right. Next up is refuse ordinance, changes and additions.
So we updated our entire ordinance when we began our own refuse service. But then we knew going into it that we had some changes kind of early on, and now we've been working at it for a couple of years now, and we're kind of narrowing down on what the issues are, not necessarily just with refuse collection, but also with code enforcement. So this isn't a major changes, but we formed a committee that was mainly like Brian and Megan Shaw, who deals with this a lot in-house, and Joey Smith was in there because he kind of helped us start the trash service. So we came up with a whole list of things, but the only thing that really affected the ordinance were, and I did get this to Lene a few weeks ago, and she said there were no issues the way that I had it written up. Really, the two changes are the ones in 5303, storage, and obviously in red, but I just wanted to quickly explain why these are in here. The first one makes total sense. Believe it or not, we didn't have anything in our ordinance that said you can't set trash out beside your coder. Now we're saying that don't set it out, we're not going to collect it. Because, I mean, there are times when that person that's awesome at trash has one extra bag or something. I'm not going to get in too deep in the weeds on that. It's never been a problem. But there's people that just need another toter or something because they continue to just set stuff out beside the can. And we made it clear in the beginning that we wanted everything in the toter, but now we're just putting it on paper in an ordinance. Any questions on that one?
Nope.
Is
The
there,
second one was,
sorry, I have a question. Ben, I have
yeah,
a question.
sorry.
Do they get like a notice or something? Is there a sticker that goes on the can or something?
Yeah.
Okay, so they know like, hey, you need to call and get another
Right.
toter.
We
Okay.
sticker them, and then there's been 4 or 5 occasions where I've just told the guys, take them another toter, and because we've talked to them, and nobody wants their trash blowing in, you know, from their neighbor into their yard, but if it comes right down to it, we just take them one because it's sooner or later you got to do something. But so the other issue, and this is maybe more zoning related, but we've had questions over the last couple of years really about people that store their toters out in their front yards. So like, we're trying to be really careful with that because there's some situations where all they have is a front yard, or they might have geographic issues like hills or like large planting areas. So the way that we worded it here was refuse toters should not be stored anywhere in the area considered as frontage, front yard of businesses or residents. Exceptions can be made to the rule by the director of service. Reasons for exceptions include, but not limited to, frontage area with specifically built toter storage areas. There are some people that have on their front, they have decorative fence up, you can't see it. So, I mean, I can't really see telling those people you can't have it hidden behind your decorative fence. Let's see. So another exception could include frontages where side or rear storage is not safe or possible. So really, I mean, what this is doing is it's not going after everybody that has a toter that maybe you can see from the front yard, but it is saying that if you make it a common theme to just pull your toters back, you know, in the middle of your yard or next to your front porch and the trash is overflowing, that's not going to be allowed. So that's the reasoning behind that one. And that one was more from, I don't know if you had situations up your head, but I mean, we'd had some zoning questions about
We've
that.
had some folks that just don't even pull them in from the curb. So we've had to deal with that, so.
And we do have an ordinance that says you can't stay in the right of way, so
All right.
at least it gives us something to go by if we're trying to get a problem toter out of the front yard.
So just as an
yeah.
example, like how my house is on the corner, I have a spot by my garage door that I just put mine on. Like that would be okay, right?
It's
'Cause I can
it's
pull
not
it in
in
my
front,
garage.
right? Is it beside though?
I mean,
Like
I'm on the
beside?
corner,
I mean,
so it's by my garage door. And
yeah,
I'm just asking for other people because it's like, I mean, I can put them in my garage, but there's a spot, they're off the road.
right. And I mean, really, that's the reason for bringing it up tonight, because I'm sure there are things that maybe we didn't think about. So,
I
I
think
mean, yeah.
I mean, I think you've got it written in there really well, you know, unless there's an exception.
I think that corner lot is always the question.
It's always the question because I
Right.
don't have a backyard. I mean, I can put
Right.
them in my garage, but I don't. There's a little spot that I put them that I put it on. I forget to take it out. But I think there's probably some houses where it's not. I mean, it's not obvious. It's not like sitting on Main Street.
Yeah, yeah, I mean, as long as it's like not obviously like it's being stored like in the middle of your front yard and things like that. But I think the out here is there's exceptions to those things, you know, I mean, we've got tons of regulations that we wouldn't even have time to keep up with, but yet we've just had some problems with some people. Okay, I can't keep it in the right of way, so I'm just gonna drag it into my front yard. Well, it's out of the right of way, you know, that kind of thing.
Yeah, and I think there's a difference between storing it on the side, and even though you're on the corner, it's visible, versus putting it in your front yard.
Right.
So I think you're good.
Yeah.
I think you better just hope the service director likes you.
Do you
I feel like
think,
hi.
can
I'm
we
kidding.
get the, that verbiage update on the water bill in the little,
Yeah, for sure.
Comment
I
part,
mean,
do
if
you
this
think?
would go through, what we've typically done, we've really, on some of these, we've actually sent out individual mailers. If it's a big enough issue it would affect enough people,
Yeah,
it could definitely go out. in a
I think
separate
that'd be
mailer.
good, yeah. Communication is always key with these type of things.
In section D, this has to do with bulk collection, but we added specific items that cannot be collected during bulk, include full-size pianos and full-size spas.
Man, I was gonna put my piano out this week. Shoot.
We've had pianos out and we've had
You're
spas
kidding.
out, and we've picked them up because it doesn't say we don't, but man, they're heavy and they take up a lot of the bulk space, so we thought it was time to kind of nix it's not limited to those, and if they set out a little mini piano or a 2-person spa, that's not what we're trying to say. We're trying to say if you set out a 6-person spa that takes up a third of the truck, or you know, a full-size piano that, you know, the truck's kind of grunting a little bit, that's not good, so.
Got it. Man, I guess I gotta sell my piano.
Well, you still got time, it hasn't passed yet.
Okay, good.
Send it out this week.
The only other one, and this came up too in the meeting, and this is from our main refuse drivers. It's 53.06, joint use of containers prohibited. We felt like we just needed to address it specifically, and that was the use of a refuse toter not belonging to said residence or commercial operator is also prohibited. In other words, if the people move out next door, the toters are numbered, and the numbers are supposed to go with your house. That means they can't just go over and A, put all their trash in those that aren't being used, or B, they can't drag them over to their house and fill them up with refuse. And that's the problem that our drivers have seen, where it's like, oh, those 2 cans are missing, and all of a sudden they have 4, you know? So we thought it would be best just to hit that one head on and say, you just can't do that. Other than that, it was, like I said, pretty self-explanatory. Any questions on those?
Can I go back to one thing with the paving
Yeah.
program? I just got one question.
Yeah.
It's awful, and I avoid it at all costs. From McDonald's to Calumet on State Route 48, I go, every time I leave my house, I go 571 to Davis, to Markley, to Calumet, because I do everything I can to avoid that area because it's awful. It's got to be even more terrible for you all driving it on a daily basis, and the police department, fire department, what have you. I know it's a state route. I know it's all through ODOT. Do we have any options out there on the table that we can look at? Because it is so horrible driving that section of road.
So finding out when for sure they're going to be paving So they didn't do all of 48 at the same time. They did some of the north, and then they did some of the south. But finding out when they're going to be doing that, because that would be much sooner than when they're going to do our section. And then, like we did on 8th Street, we just piggybacked and got their contractor price through
Yeah.
town. So I mean, it's either waiting, I don't know, 6+ years for ODOT to do it themselves, or our second option would be find out when they're going to be paving on 48 and seeing if we could hop on that, get a larger discount, or bidding it ourselves. That's our three options.
Because we, ultimately, I think we split it with them 50/50 on the Hayes Street,
Yeah,
571.
Right.
And we were able to work that out. So if you could look into that and just see what our options would be, that would be great, because
Yeah.
it's horrible.
I
So-
think, go ahead, Tim.
So if the state won't work with us, there's some options, like we could just micro mill it, okay? And then seal it like we did Calumet and try to get 5 to 7 years out of it. You know, there's a couple things you can do, but it still needs pay.
Yeah, right. Yes, sir.
There's no getting around it.
Okay.
I did, before our budget committee meeting last year, I did calculate, I did an in-house estimate on that from, basically from Donna James to North Street. You'd have to go to North because it's just as bad through the intersection as it is on North. We'd be looking at around 155,000, like, that's us bidding. If we milled and microed, that's probably a little over half of that cost, I would assume.
Well, I think, and this is just me, $155,000 for us, if it was on our own dime and we had to do it, I'm sure the residents would be supportive and fine using our current funding to make that happen, because I'm sure they don't like it either. I'm surprised there's not more complaints. I'm sure there are. But I mean, we do a very, very good job of being fiscally responsible in this village. I mean, your group alone saves the village tons of money with the work that you do behind the scenes. So my thought is for that amount of money to make it right and get it done, I would support that 100%.
So something to keep or think about is there's tons of curb work to do up through there as well. The curbs on Miami Street are worse than just about any street. So you wouldn't want to pave until everything's right.
Right.
Okay, the water's done up there, the gas is done up there. So if you're going to do, we got to look at that's our main street. It looks terrible with the curbs the way they are.
Yes.
And so if we're going to do our main street, we need to do our main street right.
Got it.
You know, you can't patch this little section and it all looks pretty.
Yeah.
And then there's no curb because it's gone. I
Yeah.
mean, because it was, paved over or whatever. So, yeah.
Okay.
And I don't know if this fits in with that, but then the sidewalks.
Yes.
If you push a stroller or a kid on a bike or a scooter, yeah, it's not good. Down Miami Street. So I know in the past we've mentioned like whatever Covington did in their, on their 48 downtown, just all new sidewalks, curbs, road.
And as we're doing downtown revitalization, that is part of that.
Yeah.
So that is part of making a beautiful downtown. Nice roads make a difference. Nice sidewalks. We could make the sidewalks wider. While we're
Yeah.
at it.
Yeah.
Plant some trees.
Yeah. That would be
Yeah.
probably 500.
Festoon lighting.
Yeah.
I'm not asking much.
Thanks.
Yeah, let me see if I can just find out when they're gonna be doing 48.
That sounds great.
And that that will answer our question there, whether that's even an option or not,
Okay.
and then we can revisit that.
Yep, appreciate it.
All right, next we have EV charging stations.
If you guys are tired of hearing me blab, I'm very sorry. I only put this on there because I wanted you guys to know that this project is still a go. This is something that I actually brought up a while back, and it had to do with my daughter-in-law trying to find a place to charge in the middle of nowhere and possibly unsafe area. And I'm like, no one has, Bruckner Nature Center has some, and then once you get into Troy and Inglewood, but we don't have any charging stations here. So I think Manager Sheridan contacted MVRPC, and then I contacted MVRPC. So we kind of talked to two different people. So I just need to combine our notes. There is some money possibly out there, but I don't know how much. But just letting you guys know, my original thought was we had two good spots for them. One would be downtown parking lot. However, we don't have the surveillance systems set up that we want to have yet down there. The other would be right here in our parking lot, which we have camera and microphone in our pickup spot, maybe directly across from there. And so I thought about this long enough ago that when we put all the electric in for the signage, there's dedicated circuits out there for that. We ended up just upsizing it ×3 so that if we ever had a big holiday display out there or charging stations or anything, we have the power out there, the boring's all done, and we're tied in. So I don't have time probably the next week or so, but I just wanted council to know that whatever happens over the next couple months, we're still, unless council does not like the idea, we're still moving forward on these, which is pretty much all I wanted to say. So.
I like the idea, and I think it's great having it here because that way you've already got the monitoring infrastructure in there. You've already got those lines, and this is the center of town. So,
Yep.
center of West Milton. So I would support it being here.
I
will-
think
oh,
it's
sorry,
awesome.
go ahead.
I think it's great.
If
You'll
there
get
was-
people here that
Oh, sorry.
have never seen this. You'll get people that come off of the roadways to come here to charge. These would be like level 2 chargers, so it's not like plug it in 5 minutes, you're gone, but it's not wait 6 hours either. The level 2s give you enough energy to get home, they might be coming through and say, this is a nice little place. I think I'd like to build a house here or that kind
Go
of stuff.
shopping in our new, freshened downtown
Yes.
with nicely paved roads and big sidewalks.
Go to Subway, go
Well,
to Dollar
maybe
Tree.
if you find and get them here and there is money, then maybe we do another one downtown or
Okay.
something. Who knows?
Worst case, there's not much available, which is kind of what Matt Lindsay was leading me to believe through MVRPC, but that doesn't mean there's not something else out there, and we would certainly, if there's free money, we're going to apply.
Yeah. And I work in economic development, and I know that I had talked to EV charging companies, and I haven't done any research, but I know that there's some out there I can reach out to.
Yeah.
Because this was a few years ago, there were some companies that were just trying to get their stations in. And when we were at ICSC, I have a cup from this place. They have these charging stations, but they're also like billboards, so people can buy advertisements, so we can make extra money on advertising. I have a cup, I'll remember.
Yeah, let me know. Any resource anybody has, let me know, because there's got to be money for this out there somewhere.
Who needs a really
That is it.
have a cupboard.
Do you have to pay to use it?
What's that?
Do you
Thanks,
pay
Tim.
to use them? I don't have an
So
electric car.
most of
Go
them, you
Buckeyes.
most of them, no. You can set up like, I think they have ones where you can, swipe your card or tap your card to use. The ones that we were looking at they didn't have that feature. It would just be, charge your car.
Yeah.
But we're in such an early stage to this that we could look at both. Yeah.
All right. Next is the safety grant.
Yeah, oh, sorry. So it should be, is that on your tablet?
It's on.
Yes, it
Yeah.
is.
Screen went dead.
It is.
So this has been totally updated. I can tell you this, that this hasn't been advertised yet. However, with the dates that are on here, the deadline's May 1st. So if we got this out this week, we're still hitting plenty of time. I had Megan double check it to make sure that I didn't forget anything, but it's ready to post. I just wanted to make sure council was totally on board posting it.
Yep. I know we talked about it before at council meeting, and we thought it was going to be done, and it did not happen, so I'm supportive of get it out. The good thing was, we had fire, police, and emergency services all applied for this last year, and all were approved for that. I will just say one thing. I can't be on the committee like last year. I had to remove myself because I was the representative with the Miami Southwest Joint Ambulance Board. So I think it was Dayon, Casey, and Sarah, maybe. So somebody has to take Dayon's spot.
I'll do it. If you guys don't care.
Yeah,
Perfect.
yeah, that's a pretty simple, I think we met like once. It was pretty simple.
Cool.
Yep.
We'll post, it'll post tomorrow.
Good. Thank you.
Ben.
Yep.
Yep, thanks. All right, next is vacant buildings ordinance. Is that-
I just want Sarah to read the whole thing.
No,
No, I'm just kidding.
that would be the mayor.
Without
would be
Lene
Lene.
here, without
That would be
Lene here,
Lene.
I mean, we're not reading it though, right? Or is there anything else we
No,
need
I
to
think we're
discuss?
just
Have we all
seeing
reviewed
if-
it?
Yeah.
I think it's as close to final form as I care for it to be, but anybody else upon
We were
reading
just
it?
waiting on Lene to add the numbers, and she's done that.
The numbers are all added for the fees.
I believe so.
Yeah, let's go through and make sure, but if that's the case, then I guess maybe we just prepare for a first reading at the next meeting.
And again, this is going to be gradually pushed out. So that is something that will be communicated to the public as well.
Right, is that language in here? Because I think we talked about even not beginning till the very beginning of 27.
So I
Yeah.
think we discussed not imposing fees, but to try to get businesses or building owners to register, right? So because it's not gonna be a full year, we can put it, you have to register again on January 1st. But just to kind of start gathering the information. And I don't think we put that in there. I don't know that we would want to, because then we would have to change it in January.
I would say then you leave a loophole, yeah. So then this is just at kind of our discretion. We're not going to assess fees for 26. We are beginning the registration program. Then beginning 27, it's full force.
Yep. I think we just need to be very clear, communicating that to the public.
Yeah.
And once we do that, we're good.
And this whole thing will be read in its entirety at
Yeah,
least
it
once
says-
at a meeting.
Yeah.
Vacant
bring it
single
up.
family, nothing the first year. On the second filing, then you'll pay $250. On the vacant single family homes, it's in here.
No, that was different, I think, for the single family versus the commercial.
Yeah,
Oh, I thought you were
a
asking
single.
that she not do it for the first year.
No. We're going to leave it as is because that would be
Yeah,
the
yeah.
fee assessed for the first full year.
Yeah.
What we're saying is what we're giving people is a heads up, kind of an on-ramp before we're just like, hey,
For
here's a
everything.
fee. You know what I mean? Yeah, no. Yeah, to be completely clear, a single family home, residential home will not be assessed a fee now, 27, whenever. A code compliant home. The point of this is not to penalize somebody, having a vacant house that they're keeping in good condition.
So yeah, I think everything's in.
Good. And I think, I know it's lengthy, but I think we need to read it fully for the first time.
We are required at least once.
Yeah,
We
yeah,
can,
to read it.
if we desire, we can waive, I believe it's the second, but the first reading will have to take place.
Yep. Sounds good.
So it goes on
For
as
April.
written?
Yeah, April meeting.
Okay.
All right, next is the Dayton Dragons game information.
So we did confirm a date, and it is June 28th will be West Milton Night at the Dragons. This is just something the Dayton Dragons reached out to us about doing. It's a fundraising opportunity. We will be, a percentage of ticket sales for this game will go to Project Revival to fund some of their events this year. So what it is it is a block of seats all located together. If you go to a link that I believe we will be getting posted on our website and Facebook, you purchase tickets through there. We'll be sitting together, represent the village. Maybe some more stuff. I'm putting feelers out to a couple people at the school. If we could get the band involved, if we could maybe get some additional advertisement going through them, I think that would be cool. I plan on attending the next school board meeting coming up in April, I think it's 21st, 20th, I don't know. But, so I'm going to bring it up there too, see what people are thinking. The thing that I think we needed to talk about, I think it was partially Sarah's idea, was doing a employee appreciation and buying a ticket, from the village, one ticket for each employee, and then if they wanted to bring the rest of their families, what have you. But yeah, we'd have to vote on that, right? The game itself is not required for us to vote on, because if the Dragons want to do it, they can do it. It's funding Project Revival. But as far as if we were to make a purchase on behalf of our employees, that's something we would have to approve together. And I don't know, I said before, maybe that's something we want to get with Jill on, about the actual how to execute that. But I think, firstly, are we all on board with doing something like that?
I'm supportive. Yep.
I'm supportive. I think it's great. Thank you for doing all this.
I think we just ultimately would have to do a resolution that would cover that, but yeah, I'm on board.
Okay.
I think letting Jill probably just figure out the best route.
Okay.
That's my thought process.
I agree.
Is that something, Manager Herron, you can kind of delegate and then work with her on to get ready for the next whatever about a resolution to purchase this? So we have until, that's the other thing I missed. Is it May 1st?
30 days before the 20 to sell them all.
40 days?
30.
30 days before June 28th.
So
Yeah, there is a deadline, but that
Could just somebody send me the data on it, and then
we'll do.
yeah, there's a couple flyers we can send.
Perfect.
Do they print flyers or they just give you a digital one?
Digital.
So yeah, they gave us a digital one. I made one with AI. That's the other thing I wanted to do, and I'm going to say this, is that I made one that had the school's Bulldog and the Dayton Dragon on it, heater, and I have permission from the Dayton Dragons to use their mascot for this. I will formally ask the school. I don't foresee that being an issue, but I just like to cross the T's and dot the I's. But I think you may have already posted it on your personal just to see if there was kind of any interest. So if you're friends with Jeremy on there, you might have already seen it. But I can make sure everybody has it, and we can all make stuff. You know what I mean?
Yeah, I mean, the school would probably share it, and then if you ask, or they send, the elementary sends a weekly newsletter if they
I
would
think
share it and not.
Jeremy had an idea about if we were to print a flyer or something, if they would be cool with sending it, passing it out, just making sure everybody's aware. And I think there's a lot of rec baseball and stuff that goes on around
the
here.
Rotary gives the Halloween parade flyer at school.
Right. Yeah, I think it'd be cool. I see it could be very successful.
Yeah.
There's a lot of. That's all I got on that. Thank you.
So next is old business.
I have one thing, just a question for Ben. I know the last thing we had with the land purchase from school, with the tennis courts, basketball court, that land up there, it was with Lene for review. Do you
Yes.
know where things are at with that?
I don't, but I can ask Lene.
Okay, thank you.
Yep.
Just was curious.
Any more?
I do. I have a question, just a question. The sign that was hit, can you just give us an update on that?
Yeah, so the police basically took a report on it for older gentleman, just kind of, I think it's maybe a medical problem or something, but I have all the insurance, made contact with the insurance company. The good news was that I already had a quote on file because of the sign we're going to try to get up on the south end, South Miami.
Down by Baker.
What's that?
Down by Baker.
Yeah. So I basically send that to the insurance company and then just I'm just waiting for their agent to call me back to okay. And then I've already talked to the Mason and said, would you have a problem doing 2? And of course he's like, no. So,
Better.
so yeah,
Okay.
insurance just takes forever.
I know.
Tell me about it.
Thank you. And then I also want to bring up last at our meeting, we talked about me participating in the Rotary. And I just kind of wanted to see if we can close that conversation, finish that conversation, get thoughts, see.
I'm supportive of that, and you, especially with what you're doing with retail strategies. If it's not you, someone from that committee, I think it would be beneficial to be involved in the Rotary if you can support the meetings on a regular basis. I think it's well worth the couple $100 that's spent for that. So, my thought.
I agree.
Yep.
That's
I
fine.
agree.
Let's do it.
Thank you. I appreciate y'all.
Yep.
Any more old business?
Only other thing is, and just so folks know, things closed with our manager job announcement. So we're moving forward with that process. We have a couple different committees that are set up. So one committee is passing things over to the next committee to take it further. So we've kind
How
of
quick are you passing it over to them? No, I'm just kidding. Is that a fast pass? Or?
so
Bounce pass.
Is this a
yeah,
personal
bounce pass, yeah. So we're doing our due diligence to get things moving to here in short order. Hopefully, get some interviews going and
Nice.
get somebody officially hired. Yeah.
Nice.
So, thanks.
Oh, I have one more thing, and I just forgot.
No,
I
you're not
promise.
allowed.
Listen, it's an easy one. So this one's easy. So we have an amazing 4th of July program. There's a 4th of July committee. We are meeting here at 6:30 this Thursday, and we would love anyone that wants to participate in any way for the 4th of July. The good news is when we have a Main Street program, we will have lots of volunteers, and we will continue to beg for volunteers. I'm just kidding. But if anyone is interested, we would love to have you, and we'll welcome you with wide open arms. And I will make pie if I need to convince someone to come along. But we would love to have it. It'll be here at Village Hall this Thursday at 6:30.
And
That's all.
And that's for 4th of July,
Yeah.
to help with 4th of July.
We're having a concert that Friday on the 3rd of July too, so can help with that too.
Sounds good.
Any more old business?
Going once, going twice.
All right.
I'll make a motion to adjourn.
We got to do new business.
Oh, I'm sorry.
Any new business?
You better not.
I'm just kidding. All right, I have one new business.
Oh, yeah.
So some of the people in the neighborhood were asked, in the new neighborhood Stillwater, about updates from Jason. So I talked to Jason Morris. He was this week meeting with Wagner Paving to see what roads need repaired before he can finish them. And he plans on, by the end of the year, having it paved, everything except the road in the back to the dirt pile and the road down to Randall. So by the end of the year, Story Point, sorry.
You're in.
By the end of the year, all the residential streets should be paved.
Wow, good.
So,
Hopefully that means progress on the north side too,
Yep.
maybe. Something.
and then he said he was closer with the bonds.
Okay.
So,
What about the gas station?
Levi asked me afterwards, and I forgot completely to ask. So,
Because that 30 days has come
Next
and gone.
week. Next week.
yeah, I forgot all about the gas station. So,
Maybe we could hear from Ron once he's recovered.
yeah.
Did everybody sign, there was the resolution going through?
Yes.
Okay.
Everybody
Yeah.
except Scott.
I'll let Scott know, I'll have him stop by.
Okay.
Thank you.
Yep, thanks. Any more new business?
I'll make a motion to adjourn.
Second.
Second.
All in favor?
Aye.
Maybe I can try that one.
No.